Yeah, I'm sitting here this morning and I'm just having my morning coffee and a little bite to eat. And I was just thinking, aging at home, reimbursement gaps, and the human cost of poor communication is so critical. And healthcare is changing fast. Reimbursement is tightening, home health visits are being reduced, and facilities are under pressure to discharge patients sooner. What that means in real life is that families are being asked to manage complex care situations at home, and often without clear guidance. And so yesterday I received a call from a woman referred by a nonprofit, and she was crying. Her mother needed a hospital bed. Insurance had authorized it weeks ago. Yet the supplier said they could not locate the authorization on file. So no one explained what the authorization meant or what equipment is included. No one followed up. And so I explained to her after I kind of told her to take a deep breath and it was going to be okay. We're going to try to figure this out. And so she wasn't our patient as far as like the insurance and things of that nature. It was through a different capitated contract. And so after she took a deep breath and she went on to tell me what was going on. And it was just so frustrating for me because I felt like no one had told her anything. So I explained to her that and she was like, well, does it come with a headboard? Like, what is it? What is included? So I explained to her that it is a bed. It's a semi-electric bed, and that's normally what they pay for. And it does come with rails. It does come with a mattress and headboards. So just know that is, if it's authorized, that's what should come with it. Okay. And so she was just still like going through her emotions, and I understood clearly what she was going through. And I just felt like, why is no one trying to help this lady? She called the provider, the supplier, and the supplier was like, oh, we don't have an authorization. And that was pretty much all they told her. Like, we don't have anything. And so I told her, like, look, call back to the insurance, tell the insurance what happened, and make sure that you have the right provider, the supplier first. Let's just do that. And if it is the same supplier, based on what the insurance tells you, then ask them to call to that supplier with you to see if they can either fax it, email it, transmit it, whatever it is that they need to do to get them this authorization so that your mother can get her bed. And literally, it took me, less than a minute to tell her that? Less than a minute. And I was able to explain when insurance authorized a hospital bed, all those things in less than a minute. Simple explanation. Didn't cost me anything, was just simple. What did it cost me? My time. And the real crisis in healthcare right now isn't always coverage. It's communication. Families are overwhelmed, scared, exhausted. A short conversation, a conference call with the insurance and the supplier or someone willing to slow down for 60 seconds can make all the difference for someone. So healthcare should be rooted in compassion, because one day I will hope to think that if I needed it, I have needed it, and my loved ones too, and someone had compassion enough to care enough to help us, And the same thing we should all think about. We should think about that, how we can be in that person's shoes one day. So if we can just take a few seconds, especially in healthcare, I'm not speaking on any other industry, I'm just speaking on healthcare, because we get this so often, how people are being treated. And it's just so sad. It's so sad. How long does it take you to share information with someone? My goodness. And that's one of the reasons why I know last year I just couldn't take it anymore. I'm like, my goodness, at least if we can share information to people, because I think knowledge is power. And so if you can just share information with people, or people have an idea on how to handle some of these situations, it would make things so much easier for people. And so if you are out there, download our free CFS app on Apple or Google. We often post blogs trying to do education. We have a podcast where we talk to people, and then we often get on there sometimes too and just talk about things that's going on or we experience, so that whenever you run across it, that it would hopefully help you also to navigate care. So that's all we're trying to do, is just navigate care with clarity and confidence. So I hope that helps somebody today. Just have some compassion for someone on today, you guys out there in healthcare, please. All right, take care.